everyone, this is Chadi Alraies from NCVH 2023. I'm really privileged today to be with Dr. Jason Yoho to talk about debulking and atherectomy options for patients for below knee interventions. Jason, thanks for being with us.
I appreciate it. It's an honor.
So it's very challenging vascular bed, and for CLI patients specifically, and everybody worries about debridement and showering distally. So walk us through your algorithm and what tools you propose.
You know, the beauty of what's been going on in our field is the technology that's advanced. And, you know, I find critical limb ischemia, it's a passion of mine, you know, very much like Dr. Walker's, and the more feet we can save, the better. It makes a huge impact on their lives. And so the key, I think, to part of the session that's been out there is that there are multiple different tools, and it's just a matter of using the right tool for the right job. And identifying those tools, same as access. And so I will use the modality that's most necessary. Today I spoke about, you know, the Arion laser. While there is no device that doesn't embolize, you know, we try to minimize that risk as much as possible. And there's some good embolization prevention techniques out there now with filters and different other techniques, but you know, the key to it is if we don't have good inflow and outflow, we're not really making a difference.
Right. So in terms of, how do you pick your device? Is it your image or based on the length of the CTO or disease?
It's a great question. I do it based on the image, right? So most of what, you know, in Texas, you know, everybody eats bigger portions and bigger plates, so there is a lot more disease than, say, you know, Colorado or somewhere else. But so a lot of ours, we have to be concerned about long, super long lesions. And so you base it on calcification, length of the lesion, and really access, because there's no point in choosing a device if you can't get it there. And you know, there is no perfect device out there. So it's a matter of putting yourself in a position to win and how to succeed. And so, you know, if you don't put yourself in a position where the device can succeed, it's not necessarily the device's fault, it's my fault, right? And so that's why we got to choose the right one. So it's really a matter of what the different anatomy is.
Yeah. So how do you manage no reflow or post-atherectomy?
No, that's a great question. So, you know, I take it from my cardiology training, right? So in the heart, there's been a couple, you know, older studies that looked at vasodilators. I'm an aggressive use of vasodilators. I'm a big fan of in between runs, giving nitroglycerin and adenosine. And you know, in the old cardiology studies, that high doses of adenosine proved efficacious and equal to, say, a filter. So the problem with CLI is getting a filter down there is pretty difficult, right? And so if you can't deliver the filter, you're not being able to do it anyways. And so I'm a big fan of distal, you know, administration of medication. And so I think, you know, taking that catheter down distally too, and almost prepping that vessel so that you have that little bit of outflow and you're protected.
In terms of ACT or heparin or 2B3 inhibitor, what's your protocol?
So it depends on the hospital versus OBL, obviously, because bivalirudin can be expensive. In the hospital, I'm more of a bivalirudin person just because the risk of bleeding is actually a little less, but in the OBL, it's a lot easier with heparin because we can also reverse it.
Do you aim for higher ACT?
I do. I aim for a higher ACT. You know, instead of doing 7 mg per kg, I kind of do 10 because that way it gives me a little bit of a buffer. And I'm not as worried about, you know, thrombosis and that sort of thing.
Well, thank you so much for your time.
I appreciate it.
And really for the below knee challenging cases, this is something you should think of and appreciate your input, Dr. Yoho. Watch these videos and others on the NCVH YouTube channel. This is Chadi Alraies from New Orleans. Thank you so much.
Thank you.